I guess I have the pleasure and honor of sharing kind of the pediatrician and clinician's perspective on this. And then also just from a dad's perspective of a 10-year-old girl who's, thinks about unicorns and rainbows most of the time and wants to do well in her exam next week. So she gets into middle school and then onwards to Harvard. I don't know. But I want to make this very human for you guys. And so the question I think that I'm facing and most of us need to be evaluating right now is, are we going to vaccinate our children under 12 years of age? If you're a grandparent, are you going to advocate that your young, granddaughter, grandson is vaccinated? And this is really where my mind has been. So what I want to go through is why I am going to vaccinate my daughter. And I want to say three things, speak, and then come back to it at the end. So the first thing is that I'm going to vaccinate my daughter so that she and I have peace of mind. And what I mean by peace of mind is that I fear acute COVID. I fear this condition called MISC, which I'll get to in a second, as well as passing COVID within our family, as well as to people around us that might be vulnerable for death from COVID. The second thing is though that she can have a normal cold and I don't have to worry about it. The third thing on why I want to vaccinate my daughter is so that she can one day return to school with minimal to no masking and not be fearful of big, massive quarantines and classrooms shutting down, to speak to some of the stressors that Sarah had just spoken about. So I want to go through a couple of those things I just mentioned. The first is just from a very contextual standpoint, which is, what does COVID infected and affected look like, when it comes to children? And I do think that most kids that get COVID, even Delta, have mild to moderate flu-like symptoms. It comes and it goes and they do just fine. Now, I was just on service about 2 weeks ago, and there's another spectrum. So it just happened to be the week that I was on. We had a group of children with severe rheumatologic diseases, including lupus, that were not faring very well. And I had one child who was a teenager whose lungs literally melted from COVID in the context of the immunosuppression. And that child will have a lifelong pulmonary disease that's not going to go away. The second thing that I want to mention is that both of those situations, for the most part, are vaccine preventable. The second thing is talking about MISC, which stands for multi-system inflammatory disease in children. This is coined a rare, very rare, very, very rare, or very, 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 very rare condition, meaning that we don't exactly know the rates, but it's common enough that in the surge that we just had in Shands, I'm approximating around 20 kids were admitted with this condition. Now, back January, when we first started seeing this condition, it was clinically the scariest clinical condition I've seen as a physician, and I've seen a lot of sick kids. One of the reasons it was that it was a new disease to us, and we were just developing the guidelines. And what I was seeing was left-sided heart failure. I was seeing inflamed muscle tissue. I was seeing neurocognitive, neuropsychological, encephalopathy, encephalitis. And we didn't have our treatment plan sorted at that time. And I would say that with this recent surge, we have it a lot more sorted, and we have a better sense of how aggressive to be, and we're able to tone it down pretty quickly before we see quite scary cardiac deficits. But that too is vaccine preventable. If households get vaccinated, there's less COVID in that household and less chances of kids getting exposure. Likewise, if they themselves get vaccinated, it reduces their chance. So then the third thing that I want to talk about is really more the COVID affected, which is what Sarah is mentioning. And for this is maybe the most important thing, which is maybe the child themselves didn't have a terrible experience with COVID, but there's a good chance that someone around them has. And the affected is massive. So I want to share a story that I'm committed to sharing based on experience I had about a week and a half ago, which I had a child between 1 and 2 years of age who was admitted with what I thought was just asthma. And as we do as physicians now, we ask the family if anyone in the household has had COVID. And I was in a dark room with a child that's having difficult breathing from asthma. And the strong and stoic mother at the bedside shared with me that in fact, her husband in his mid-30s had died in late August from COVID. And that 3 weeks ago, her mother had died from COVID. And she had 4 children at home. And she was in the process of trying to explain to them that their dad was no longer going to be at home. Yet she had been in the hospital so much with, doing the care managing, she had yet not been able to share that story with those kids, and they were still looking for their dad. And this is a person in her, socioeconomic situation that I knew that her story was not going to be told. And when I look at the curve, and I'm about to show you it, on mortalities in the last 3 months in the state of Florida, she is one dot on that curve, and she's just one of 16,000 dots. And many of those dots stories are not going to be told. So I've just shared with you the thing I care most about. Moving forward. And I also want to say that last story, in the overall context, is also vaccine preventable. So the next part is, why act now? And I believe that there is plenty of wood still to be burned in this fire of this COVID-19 pandemic. Herd immunity is a complex conversation. And what's important when you're discussing it is that immunity decreases, migration happens, and behavior change, I almost view it like an onion. There's different layers to behavior change, and we're kind of just taking peels off of it. And that affects herd immunity. So I've been emphasizing vaccine throughout this presentation, but what's the downside of vaccination for my kid that's 10 years old? And I do think there is 2 downsides, and we can't avoid them. The first is that, yes, you're going to have a day and a half, maybe 2 days of maybe malaise, a low-grade fever, and an achiness. That is much better than having severe acute COVID, MIS-C, or passing some COVID to someone in your household. The other thing, which is more rare, and we do have numbers on, which is rates of myocarditis and pericarditis, which are treatable. And in a JAMA paper that was published just recently, that looked at adolescents that got this condition, there were 0 deaths from kids that got that disease associated with the vaccine. And the rates are about 1 in 2,000 might get that. And I don't have those rates from the vaccine trials. They've been done in 5 to 11s. That's the overall rate. But even at 1 to 2,000, I'm willing to take that risk with my daughter. I think that's an okay risk to take. So then going to my slide, I just want to paint a picture of what is vaccine preventable, because I do not think that we're done with COVID. And this is maybe the best image that I've seen from Lancet ID that recently published by Saw et al., in which this upper curve for Florida is what we saw. This lower curve, this blue one, is what would have happened had we had 74% vaccination by July 31st of this year. The area between this curve and this curve could have been avoided. And then there's a little teeny purple curve in here, which was Had we increased the rate of daily vaccination by 50% suddenly on September 1st, at that point is too late. The outbreak was going too fast. We couldn't have actually slowed it down very much. But had we taken action back here, we could have avoided this. And so I think this can be a warning sign for the future on how to move forward. If you're speaking with people outside of an academic world, I think there's an even better way to paint these numbers. And I'm not a statistician, so this is a disclaimer that there are some assumptions made here. But if we take 58,000 deaths from the New York Times visualization, subtract 42,000 deaths that happened in the state of Florida before roughly the August time, that gives us about 16,000 deaths that just happened. Surfside condo collapse had 98 deaths associated with. 16,000 divided by 98 is 163 Surfsides happening in the last few weeks. You can take it even farther, and this is probably where I would need a statistician, which is that in the city of Miami, there's 469 tall buildings. And 469 divided by 163 is about 1 out of 3 tall buildings collapsing. Now, I'm not normalizing for the height of the building or the number of floors or the number of people in those buildings, but I think these are real numbers that we can help people visualize around this problem, which takes me back to my main point, which is why am I going to vaccinate my daughter? So that I can have peace of mind, so that she can avoid acute COVID, MIS-C, and spread it, so that she can have a normal cold and I don't have to worry. And 3, so that she can one day return to school unmasked and not have to worry about her class being shut down. Thank you.